To another topic about safety, and this is one that Sarah brought to my attention. Thank you, Sarah. And this is a topic revolving around, are facial fillers dangerous? And so this actually comes from a recent social media post, and if you're on TikTok, you may have seen it because this thing has millions and millions of views. And I actually clipped it. So Travis, can we roll this this TikTok announcement?
Guys, I think that we might be like watching human experiments almost happening in real time on celebrities and influencers and young women. We do not know as much about filler as we should. This is a video of two board certified plastic surgeons, one of them's also a radiologist, talking about how shocked they were to see migrated filler and just filler lasting years after it was injected.
I think one of the patients I sent you I injected filler out here and it sort of migrated to the mid-cheek or migrated around the outside. So after it took about 4 or 5 years ago we injected her, or I injected her 4 or 5.
This is all stuff that needs to be looked into, and I think in the next 10 years we're going to come up with some very interesting stuff and find out a lot of new things that are going to have a few surprises.
Yep, it's pretty scary. So, I mean,
I don't know about you, but I don't love that a plastic surgeon who's been injecting women with filler for over 15 years is talking about how scary it is, how much we don't know. This is also echoed by another doctor who said, "It's unclear what's going on with filler. It's unknown whether after 10 or 20 years it's still maintaining the properties that it did when it was injected. More studies are definitely needed." Are we the studies? Millions of young women are getting this every 6 to 12 months.
So yeah, so I mean the video, so I watched her video and then I actually found that YouTube video of those two guys that were talking about the filler, and I watched the whole thing. It was kind of painful, to be honest, and to be just totally blunt, I didn't really think very highly of those two guys after I watched their video. I think it's a lot of hype over not really anything significant. So the gist of what their video was talking about was that dermal filler can last longer than advertised. And they kept saying that dermal filler should last 6 months. I mean, I tell our people, at least the ones we use, that 12 to 18 months is kind of the target. But that's just a range. I mean, I've had people that got dermal filler and you can absolutely see that it went away in 9 months.
Yeah.
And then I've had people that come in at a year or 18 months, 15 months, wanting to repeat their dermal filler. I'm like, look, your dermal filler is still there. You don't need it yet. And so, they're saying, oh, well, dermal filler, lasts longer in some people, because we got MRIs to show that it's still there. I'm like, big whoop. Okay. I mean, everyone knows that.
Yeah. I
mean, it's not anything new. I mean, we know that dermal filler can potentially last longer than the stated rate. So I just okay, well, that's nothing. Just because you're getting an MRI to prove it. I mean, I've gotten CTs on patients of mine for just random reasons. Somebody, comes up with an infection and we're looking to see if there's an abscess, and you can see the dermal filler, and it's okay, cool. I mean, yeah, it's there. And the other thing that they were talking about is that they're concerned about dermal filler migrating. Now, what that basically means is you inject the dermal filler in one location and it spreads away from where you injected it. And once again, I say, duh. I mean, if you put the needle in and you unload the entire dermal filler into one spot, what happens was it'll take a path of least resistance, which if you get in the right plane, meaning there's layers of tissue, in your body, like skin, fat, fascia, more fat, muscle, or fascia and then more muscle. If you get into one of those little tissue planes, it can spread pretty easily. And we remember when we talked about the flesh-eating bacteria and the necrotizing fasciitis? Yeah. Why does it move so fast? Because it gets in a tissue plane and it's easier to move. So yeah, I mean, dermal filler can move, but that's a technique issue. I mean, don't dump the entire load of filler into one spot. Do smaller injections so that way you're not, potentially increasing the risk that it might migrate. And so yeah, I mean, I watched these guys' video and I was just like, okay, I mean, you're not saying anything new. I mean, as a plastic surgeon who's been doing filler for, over 15 years now, okay, I mean, what you're saying is not wrong, but, that whole thing about, in the next 10 years, we're going to see these studies that, are going to be bad. I mean, BS. I just don't believe it. I mean, I had to actually look up how long we've had hyaluronic acid fillers. I mean, it's been over 20 years.
Yeah.
And so I just want to kind of recap. Well, one, I wanted to address that video because, I mean, to me, this is just people, trying to post something controversial for clout.
Yeah, she did look different than she normally
does.
Is.
Right. That was Kylie Jenner.
Yeah,
right,
she looked like...
And honestly, I didn't recognize her at first.
Yeah, she looked like she had just gotten something done, in my opinion.
And honestly,
like her under her eyes was like really puffy.
She'd had voluma or something.
She had something
Sculptra.
done recently that
Which,
made her
I mean,
face
for her
puffy.
is not a good thing because she's so young. I mean, a girl at her age doing all of that makes you look older. I mean, she looks like somebody in her 30s or 40s.
Yep.
I mean, not that she looks bad, but just that look of being filled.
Yeah, she looks mature.
She looks
too
mature. Right? She doesn't
for
look
her age.
like her age anymore.
Yeah.
And I want to go over that, but I just mostly wanted to address that video that's gone so viral and these two guys that everyone like, I was reading the comments like, oh, finally a plastic surgeon is telling the truth. I was just like, come on. I mean, so anyway, I did want to pull some data on the safety of fillers. There's actually a really great study from a few years ago about, it's kind of here it is. And so Rod Rohrich, who is arguably one of the most famous plastic surgeons around right now, he's actually from Dallas. I mean, we've talked just in passing on social media. This is one of his studies, and I really think highly of him. He writes a lot about proper use of plastic surgery and plastic surgery techniques. So you guys can pull this study if you want. It's basically looking at the safety of hyaluronic acid fillers, and it goes over all the risks, which I'm going to kind of go over with you guys right now. And there are other studies out there, but this one kind of hit most of the highlights. And so I would say that the first thing I would mention is like, what do I think is the most likely risk of getting fillers? And I think it's exactly what Kylie Jenner has in that video is, I think honestly your biggest risk is getting bad work or getting overdone work.
Yes.
I mean, we see that all the time. How many times Madonna, remember her fillers, and then who we talk about, Courtney Cox at one point.
Well, it's like, it's easy to have done, right?
Yeah, and everyone's doing it. I mean, I think in the old days, when I first started this, like you had to be a doctor to do filler. Well, that's not the case anymore. There's nurse injectors, there's esthetician injectors.
I literally showed this video to my daughter, and she goes, "My stepmom has those in her mouth, like in her lips." Yeah. And I was like, "Oh, okay."
Well, and
because I was watching it, and she was like, "Who's that?"
And kind of going back to talking about being overdone, I do like fillers.
Yeah.
And
they serve a purpose if
they
they're
do,
used
but
correctly.
Like, the way that fillers should be done is that no one should really know you have them. I mean, that's the best filler work, is that no one realizes you have them.
Well, isn't that like the basis of plastic surgery?
Right,
really?
yeah, the best plastic surgery is a plastic surgery no one knows you've had. And so when I do fillers, I try to do a more conservative approach. Like if we're doing the lips, just make them look nice. Don't make someone look like Angelina Jolie.
Yeah.
Because that looks fake.
Yeah.
And
except Angelina Jolie's are real, right?
yeah,
her mouth is real.
I think they are.
Yeah.
Because she's had those lips. You can
Her
look at
entire
pictures
life.
of her. Yeah, when she was young. If you're gonna do filler in the cheek, don't make someone look like Madonna looked with the
alien
crazy
type face.
alien shaped head. I mean, there's ways to do this right, and that's where it comes to that fillers are art. I mean, I'm all about the artistry in plastic surgery. And let me tell you, like Botox, that there's a little bit of artistry to that, but there is a lot of artistry in fillers, and you can make them look fantastic or you can make them look terrible. And to me, that's the whole trick. If you're a consumer wanting to get fillers, you got to find that person that's really good at them. If people are walking out of their office and you're like, holy crap, that person obviously have fillers, then I guess it's possible that person asked for that, because I have had times where someone comes in and wants a filler, like lips, and I do lips, I'm like, oh man, your lips look perfect, and then a month later they come back and want more, and I'm just like, please don't do it. But at the end of the day, if somebody wants to do something just because I don't agree with it, as long as it's not unsafe, I will. So I've had a couple people that I've filled more than I want, and they were fine. They didn't have any complications. But to me, you could tell they had it done.
Yeah.
But talking about actually the more significant risks of fillers, because we don't really talk about this very often because the rate of complication is so low. I mean, most of the time when you hear about complications with fillers, it's not even necessarily complications, it's just bad work. You know, somebody has to get hyaluronidase, which is and then we should mention, so there is a way to dissolve fillers. It's called hyaluronidase. But let me tell you, in over 15 years of doing fillers, I've used hyaluronidase 0 times.
Okay.
If you are good, you should not have to use this product. I mean, if there's some place where they're using hyaluronidase, like on the reg, avoid it.
Right.
I mean, I don't even carry it in my office because we've never had to use it. Now, when we open up our med spa, we're probably going to carry it because then we have other injectors and whatnot. But talking about the more, I guess, more realistic risks or complications of fillers, you know, the number one, and this comes from the Rorik study, I mean, number one risk is probably bruising. I mean, you're sticking a needle in someone, and there's a risk that they could get a bruise or a local reaction. I mean, that's not really,
that inflammation.
Yeah, that's not really the filler's fault. You know, if you get like a bruise.
Just like the process.
Talking about the most severe risk, okay, what's like a worst case scenario with filler? Well, I mean, worst case scenario with filler is blindness. Now let me tell you, the risk of blindness comes from injecting the filler into an artery and then getting retrograde flow back to the arteries of the eye and then having that form an embolus or a clot in the eye and killing those cells.
Does it have to be like really close to your
the most common sites that happens is glabella and then the temporal area. And when I read that, I was like, why would anyone put filler there? I mean, that's not a place that we put filler. I mean, filler goes lips, very common, nasolabial folds, marionette lines, cheek area. And it's like, you know, okay, I mean, yes, there are people out there putting filler in those locations, but not a lot.
Yeah.
And, you know, the way to avoid that is, it goes again back to like the migration. If you like put a needle in and you start dumping filler, yeah, if you hit an artery just right, you could cause that filler to get in the artery. But that's not really the right way to do filler. I mean, it's better like if you're moving it around, that way you're less likely to get it stuck in a blood vessel.
Right.
So once again, that stuff comes back to technique and making good decisions. You know, other risks, if you get filler into an artery there and it doesn't go back to the eyes, you can get tissue necrosis. I mean, I've never seen that. I mean, not even just in my patients, but I've never even heard of someone getting that. I mean, I think there's case reports of it, meaning this one person out of millions of people had it happen. So yeah, I mean, the rates of that's extremely low. I guess the last thing, kind of a late reaction, you can get a foreign body reaction to filler, meaning it's in there for a long time and your body's kind of like eventually like, okay, this shouldn't be here. Let's reject it or attack it. And then in that case, you know, you'd want to use your hyaluronidase. Infection's also a risk, but once again, that's really, really low. So yeah, I mean, in general, fillers are extremely safe.
Yeah, like what? So like if somebody wants to go get fillers after like watching this, they're like, oh my gosh, like now I don't know if I want to. What's something that they can like look for, like when they're looking for doctors?
So I mean, you know, I'm always gonna say that having a doctor, especially a plastic surgeon or dermatologist can be very good at as well, inject you is going to be your best bet, but realistically that's tough. Like for example, if you call my office and you say, hey, I want Dr. Hermann to do my Botox or filler, my office is gonna try to send you to one of our injectors because it's hard for doctors to take that time to do it. It's not cost effective. Now I will do it for people, and I have some people that I routinely do fillers on. So, I mean, finding a surgeon to do it is great if you can. If you can't do that, then I think the best thing is to really vet the people that you're gonna go to. Like talk to them, ask them how long they've been doing it, ask them to show you some results and have very clear communication of what it is you're looking for. And also too, I think one of the most key points is if you don't want to look artificial, you need to tell your person that.
Yeah.
You know, and if they're a good injector, they can give you filler to alleviate issues you might have, but not to a degree where someone else is going to know you've had it. Because once again, as I always said, and you said earlier, the best plastic surgery or procedure is the one that no one knows you've had.
Yeah.
So, yeah, I think vetting your people is important. I mean, nowadays a lot of these injectors have befores and afters. Even our people have their own Insta and have their befores and afters. So yeah, I mean, if you go to someone's social media and I mean, I don't think people are stealing fake befores and afters. I think, for the most part, they're legit. Look at the befores and afters and see if you like them.
Yeah.
If they look like, Madonna looked at the Grammys or whatever, then, be aware. Yeah. Right? So yeah, I think that whole video that was posted is kind of nonsense. I mean, it's good to talk about fillers and what are the risks, but that video is all about hype and, making something out of nothing.
Yeah, trying to get people scared.
Yeah. Right, I agree. So, all right, cool. Fillers. That was a good conversation. I don't think we've ever actually talked specifically about filler complications. That was good. Thank you. You found that one.
Yeah.
It's funny. I have people nowadays, like almost every single day, somebody I know will send me something they found.
Yeah. So I found like
about
a new,
Send them my way if you see them.
plastic surgeon guy that does TikToks, like more of like he is making like funny TikToks. Have you seen that guy?
Which one is it?
I don't know. He kind of looks Hispanic, and he's always wearing his scrubs.
You'll have to send it to me. I mean, a lot of those guys I know.
He makes funny ones.
Because I used to do those. I mean, forever. Like, this is how the show got started. Is I was actually pretty big on TikTok. I think I have 150,000 followers, which is not huge, but not insignificant.
No.
And I just got kind of disillusioned with TikTok. I'm going to go back to it. Yeah, I just haven't been focused on other platforms.
Yeah.
So, yeah, you'll have to send me. If you see something, send it to me.
I'll send you
If you guys out there see something interesting and you want me to talk about it, please send it to me. You can either send it to my Insta or you can write in a comment on one of our YouTube videos. I mean, if you find something interesting, I'd love to talk about it. So.